Let me introduce you to the speaker today, Dr. Reza Banashi. He's a biostatistician and a research fellow at the Australian Women and Girls Health Research Centre at the University of Queensland. Since joining UQ, he has been working in longitudinal data analysis, advancing methodological approaches in studies of multimorbidity across the life course. Before 2020, he has been working in Iran on estimating the size of hidden populations. He has authored about 200 peer-reviewed publications and co-authored 2 reference books. Reza was serving as a consultant to the World Health Organization to assess the practicality of size estimation methods in the Middle East and North Africa region. Reza, over to you.
Great. Thanks, Darcy. Hello, everybody, and thank you for joining today's talk. The title of the presentation is Estimating Size of Hidden Populations in Sensitive Context, and I have some examples in the setting of HIV, reproductive health, and mental health. So just an overview of this talk. This talk is not about a single method, and during the presentation, I will not speak about details of our sampling procedures. We can discuss at the end of the talk if you are interested. But I'm just trying to share insights from multiple studies conducted over 1 decade, 2010 to 2020, in Iran to estimate size of variety of hard-to-reach populations. Some of these studies were student projects, some were nationally funded studies, so they were at different quality level. And remember, these studies were conducted in tough circumstances. For example, our data collectors were arrested on 2 separate occasions. But our aim was to provide an informed approximation of a hard-to-reach population to policymakers because those years we didn't have any reliable data. So in that 10 year, over that period, we published nearly 40 papers. We authored the book Methods in Epidemiology Population Size Estimation, which is published in 2021. We had several consultancies to WHO and UNAIDS to assess the feasibility of size estimation methods in Middle East and North African countries. And now we are regularly invited to guest lecture on this topic at University of California, San Francisco. So let me start with some terminology. What do we mean by hidden or hard-to-reach group? Hard-to-reach groups are populations that are difficult to identify due to a stigma or legal concern or religious values. In the context of HIV, these hidden groups include female sex workers, people who inject drug or PWID, or men who have sex with other men. So we didn't have reliable data on number of PWID or female sex workers in Iran those years. In other settings, examples include abortion, so number of women who had abortion last year, or number of people who attempted suicide. What was the main challenge? Assume you want to estimate prevalence of something non-sensitive, for example, diabetes. How do you ask? You approach a sample of participants and then you ask them, have you ever been diagnosed or treated for diabetes? That's it, because it's not a sensitive question. But when the behavior is sensitive, asking direct questions such as have you ever injected drug or experienced violence or blah, blah, blah is prone to underestimation because people don't want to reveal this sensitive data. Even if we use self-administered questionnaires and sealed boxes, still people may refuse to participate or they may not be willing to reveal the truth. So in those circumstances, conducting household surveys or telephone-based surveys poses extra challenges because people think they are tractable. People think that you can find them in future. Okay. I categorize population size estimation methods into two main categories: indirect methods. Indirect methods are methods we don't need any registry data. There are a variety of indirect methods. I will speak about these four ones: single sample count, crosswise, proxy respondent, and network scale-up. And then there are some direct methods. For direct methods, we need some registry data, or we should be able to contact with some members of the hidden population. The main methods include truncated Poisson model, multiplier, and capture-recapture. So indirect methods have practical appeal in the MENA region because most of these groups, we don't have registry data. We cannot access those people because of the high level of stigma. So the main emphasis of my talk is about the indirect methods, but I also have some examples of direct methods. I will start with indirect. Okay. If I want to visualize indirect methods, that's how it works. So you look at the right, you turn the ball to the left. So you ask something, you estimate something else. Rather than asking a direct question such as, have you ever been injected drug? We rephrase the question in a different way. Okay. So now let's start with the first method, first indirect method, single sample count. Here you see a list of 4 statements. My national ID card is an even number. My date of birth is in the first 15th day of the month. The year of my birth is even. I was born in the 6th month of the year. So you see each of these questions, the probability of yes answer is 50%. The probability of no answer is 50%. So if I give you a card with these 4 statements and ask you how many of them are true for you, then your answer is something between 0 to 4. So if you say 2, it means 2 of them are true for you, but we don't know which 2. Okay, now assume we approach 1,000 people. Each of them tell us how many of these statements are true about them. They put their answers in a sealed box, and we calculate the average. What's the expected average? Remember, we have 4 statements. The probability of yes to each of these statements is 50%. So the expected mean would be 2. Okay? Okay, but we don't give people this list. Now look at the list on the left side, on the right side. We give them a list with 5 statements, 4 non-sensitive statements, each with 50% probability of yes, and the last one is the sensitive question. Now we ask people to tell us how many of these statements are true for them. So now the answers are something between 0 to 5. When we calculate the mean, it's 2 something, and we can attribute that something to the intentional abortion, to the sensitive question. So in this example, our sensitive behavior was intentional abortion. So that's the trick. We give them a list. There are 4 questions. They are not sensitive. Probability of each of them is 50%. The last statement is related to our sensitive question. We calculate the mean. We know it should be 2 something, and then that something attributes to the sensitive characteristic. So we applied the method in Iran. We recruited nearly 1,000 women. We applied this method, and we estimated the annual incidence of intentional abortion at about 15 per 1,000 women of reproductive age. When we applied this figure to the number of women at reproductive age, this was corresponded to nearly 250,000 abortions annually, which was shocking for policymakers. I remember when we presented the results, it was shocking for them. Now I will go to the second method, crosswise method. Crosswise method has a different philosophy. For example, let's assume we want to conduct a study and estimate the lifetime prevalence of illicit drug use among students. Okay, we pair this sensitive question with a non-sensitive question. So there are 2 statements. I used illicit drugs at least once in my life, and the first digit of my phone number is 2. So one sensitive question is paired with a non-sensitive question. And we know the prevalence of the non-sensitive question, because for the non-sensitive question in this example, the prevalence is about 10%. Then we ask respondents to select option A if the answer to both statements are the same, and option B if the answers are different. So if you select A, it means that your answer to both of these statements is yes or no, but we don't know which one is true. If you select B, it means then one of them is true, the other one is wrong, but we don't know which one, okay? So by asking indirect questions, we persuade people to participate in the study and answer the question. And then there is a simple formula. Because we have the prevalence for the non-sensitive question, we can calculate the probability of the sensitive one. We used the method in a university in Iran. The results is really, really interesting. We applied both methods in this study. We used direct method and crosswise method. When we asked direct question in the total sample, the lifetime prevalence for any illicit drug use was only 3%. But with the crosswise methodology, it was about 20%. So this ratio shows more or less this ratio shows the level of stigma. When we analyzed men and women separately, we saw that for men in the direct method, the prevalence was 6%. In the crosswise, it was about 23%. So the ratio is something close to 4. For women in the direct approach, the prevalence was about 1%. In cross was about 18%. So a ratio of more than 15, which shows the level of stigma was much, much higher among female students. Now I want to speak about the third method, proxy respondent. Do you remember we had 4 indirect methods? The first one was sample count. We speak about that. The second one was crosswise. We speak about that. The third one was proxy respondent. So again, it's an indirect method. In proxy respondent method, each respondent replies on behalf of his or her close friend. So we select a sample of respondents and then ask them to select a close friend and reveal that whether that close friend, whether that person have the risky behavior of interest or no. So the main assumption of proxy respondent is that the sample of selected respondents and alters, their close friends, form a representative sample. So we used this method in another university in Iran. We recruited 500 students. We selected 30 female names distributed on 6 cards. So on each card, there were 5 names. And we also selected 30 male students, again, distributed on 6 cards. We asked students to select a card by random and then a name by random and then identify the person closest to them with the name on the card. And our definition was for a close friend was that someone you spend more than 2 hours per week out of the class. And then we analyzed the data. Again, in this study, we used both direct and proxy respondent. So in the direct, the students replied on behalf of themselves. In proxy respondent, they replied on behalf of their close friend. And again, you see in the indirect method, in the proxy respondent, the prevalence was higher. So for opium, the prevalence was about 5% in the direct question and slightly above 9% in the proxy respondent. Can you find a source of error in proxy respondent? Because here we ask people to select a close friend and tell us whether that close friend has the risky behavior of interest or no. Still, there are some problems here because these information are not disclosed. I cannot be sure that I'm aware of sensitive characteristics of my close friend, although we are close. But still we see that despite this source of error, we see that the estimate in proxy respondent is higher than the direct methods. Okay, let's move to the fourth method, network scale-up method. What's the philosophy of this method? This method assumes that respondents are more likely to reveal sensitive characteristics of members of their network rather than themselves. So more or less, network scale-up can be seen as an expanded proxy respondent. In proxy respondent, you select a close friend and tell us about that person. In network scale-up, you tell us about members of your network. So it's not just about one close friend, it's about all members in your network. So you can see that network scale-up needs much lower sample size because each respondent answers on behalf of the network. So instead of asking, have you ever, blah, 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 for example, have you ever injected drug? We ask how many people you know who have injected drug. And then the assumption behind the method is that the prevalence of something in my network is the same as its prevalence in the general population. So, for example, the prevalence of people with diabetes in my network is the same as prevalence of diabetes in the population, or prevalence of drug injectors in my network is the same as prevalence of drug injectors in the population. That's how the method works. This is an assumption. We also need a definition for know. When I tell you how many people you know who are engaged in this behavior, what do we mean by know? The standard definition in the literature for know is that individuals one recognizes in person or by name can communicate with if necessary and has had a personal telephone or email contact within the last 2 years. So if you ask me how many presidents you know, I should tell 0 because I cannot communicate with them. So that's the definition used in the literature and the definition we used in our studies in Iran. So it's a graphical presentation of the method. Let's assume, for example, let's assume we want to estimate PWID, people who inject drug in a city. This rectangular shows the city. The circles inside rectangular shows people who live in the city. So the total number of people in the city is shown by T. That blue is me. You ask me how many drug injectors you know, okay? That circle shows my network size. So we assume that, and here the red circle shows drug injectors. We assume that proportion of red circles in my network is the same as proportion of red circles in the general population. So if you ask me, for example, how many drug injectors you know, if I tell you 2, then M equals 2, and this is my network size. We show the network size by C. So the proportion in my network would be M over C or 2 over C. And then what's the proportion in the whole population? It's total number of drug injectors shown by E divided by the total population shown by T. So keep this formula in mind because I have some toy examples in the next slides. M over C equals E over T. That's how the network scale-up method works. M over C shows the prevalence in my network. E over T shows the prevalence in the general population. M is the number of hard-to-reach group I know. C is my network size. E is the total number of hard-reach group in the population. T is the population size. Okay, so what are the requirements for a network scale-up study? We first need to have an estimate of C because we need to calculate the proportion in the network. And then we need an estimate of the size of the hidden group. We also need some correction factors to adjust. Why? Because when you ask me how many drug injectors you know, let's assume my network size is 400. Let's assume I have contact with 400 people. Sensitive information are not disclosed. I'm not aware of sensitive characteristics of everybody in my network. I need a correction factor known as visibility. And then I need to adjust my size estimations by the visibility factor. There are a variety of methods to estimate visibility factor. Visibility factor, a method frequently used is game of contact. So for example, for a target group like FSW, VF means what percentage of people who link to an FSW knows about her sensitive behavior. So network scale-up used in some countries. In US, they used it to estimate annual number of rapes or heroin use. Some European countries use the method. In Asia, China, Japan, Singapore use the method. In Africa, Rwanda, and we use the method in Iran to estimate size of several groups. As I said, the first step is to calculate the network size. Few countries in the world estimated the network size. As you see, it varies from 175 in Ukraine to nearly 364 in Japan. So it's something in this range. We estimated the figure for Iran to be around 300. It means that each person in Iran knows about 300 other people. That's what it means. Okay, now I have a toy example to clearly explain how the network scale-up method works. Let's assume we want to design a study and estimate number of PWID in a city with 2 million population, okay? So T is equal to 2 million. You approach me, you ask me how many PWIDs you know, I tell you 5. So M is 5. Okay. What's the proportion of PW in my network? Do you remember the formula? M over C. So M over C equals 5 over C. C shows my network size. And then what's the proportion in the general population? It's E over T. So it's equal E divided by 2 million. Okay, so now we know that 5 over C equals E over 2 million. 5 over C shows the proportion in my network. E divided by 2 million shows the proportion in the general population. But we cannot solve this equation because there are two unknown parameters. So for a network scale-up, we should not start with the hidden group. We first need to estimate the network size, C. How? You do not start with the hidden group of interest. You start with a group with a noun E. See here in this formula, 5 over C equals E over 2 million. There are two unknown parameters. If you change your question, if you first ask me, for example, how many teachers you know? Okay, so instead of a sensitive question, you ask me about a reference group with a noun size. For example, number of teachers or number of people, they are named Sophia, or number of people with diabetes. We have some accurate data about the number of these groups in the population from registries. So, for example, you ask me how many teachers you know. Assume in this city with 2 million people, 10,000 teachers live, and I know 2 of them. So the proportion of teachers in my network size is equal to 2 divided by C, and then the proportion in the population is 10,000 divided by 2 million. It's solved because 2 over C equals 10,000 divided by 2 million. If you do the calculations, then my network size is 400. So you start with a reference group with a noun size, you estimate my network size, and then you ask the sensitive question. Now you ask me how many PWIDs you know. I tell you 5. And now the proportion in my network is 5 over 400. We say, okay, 5 over 400 equals E over 2 million. We do the algebra, we estimate a crude number of 25,000. But why it's a crude size estimation? Because when you ask me about number of PWIDs in my network, these information are sensitive. I am not aware of sensitive characteristics of everybody in my network. There are some cases of PWID I am not aware of. So we need an estimate for visibility. To estimate the visibility, we need to conduct a study among the PWID. I don't want to go through the technical details, but just another toy example. If a PWID knows 5 people named Sophia, and if 2 of these Sophias know that the person is a PWID, then the visibility factor is about 40%, 2 divided by 5. If I use this correction factor, if I divide my crude estimate 25,000 by 0.4, then my adjusted estimate is about 62,000 or 3%. That's how the method works. So it's not one single study. It has at least three components: a component to estimate the network size, a component for crude size estimation, a component for calculation of visibility factors. But each of these components can be an independent study with lots of lessons. In reality, to estimate the network size, we start with multiple reference groups. The guideline says that usually start with 20 reference groups with prevalence between 0.1% to 4%. We don't select a reference group with prevalence of 10% or 20% because then people cannot give us reliable answers. We combine all answers to these 20 reference groups to calculate the C, and then we use the final C to back calculate the size of the reference groups. Now we have the real size of the reference group, the back calculated size. We can calculate the ratio. Ideally, we like these ratios to be close to 1. If the ratios are close to 1, it means that our C can accurately back calculate size of reference groups, and then we can use it to estimate size of hidden groups because it's tested. But if we see for some groups the ratio is far from 1, it means that those reference groups are not accurately answered by people. So we exclude the reference group with a ratio far from 1, then it's an iteration process. We continue to make sure that all reference groups are reliable and our final C can accurately back calculate size of the reference groups. And then we use it to estimate the size of hidden groups. I just want to share some of our results. We estimated the visibility factor for female sex worker in Iran about 45%, visibility factor for IDU at about 54%, and visibility factor for elective abortion at about 8%. For medical abortion, 60%, for spontaneous abortion, 50%. So what does that, the visibility factor of 8% for elective abortion means? It means that if we use network scale-up in Iran to estimate annual number of elective abortions, then we need to multiply our estimate by a factor of 10, even above 10. Let's assume this 8% is 10%. For simplicity, let's assume it 10%. It means that if we use network scale-up, we need to multiply our final estimate by a factor of 10 because this is really, really sensitive because the visibility is really low. And even comparison of these figures with each other are really interesting. See here, the visibility for sex work was about 50%, but for elective abortion, it was as low as 8%, highly sensitive. And just another example of our publications, we conducted 3 rounds of surveys in 2013, 16, and 19. Results of each round was published separately in the paper about our 2019 papers. We also look at the trend in use of these drugs over time. And I just have an example for you. For example, for alcohol and for hashish, with an upward trend. For alcohol, the graph shows the prevalence per 100,000 population. We see an increase of about a factor of 2 from 2,000 something to nearly 4,500. For hashish, we see an increase of about a factor of 3. It increases from 500 per 100,000 to something like 1,500. So this is another use. We can repeat the survey, different time points, and then use it to assess the trend over time. This is another example of use of the method. In this paper, we tried to use network scale-up to estimate the treatment failure ratio for methadone. Methadone maintenance therapy has been widely used for the treatment of drug use and then treatment failure ratio, showing the ratio of relapse among methadone users, is an important index for evaluating MMT or methadone maintenance therapy. We use this method and we calculated the treatment failure ratio at 52%, which was really, really high. So it was an overview of the indirect methods we used. I just have some general recommendations after publishing several works in this field. Each size estimation method has its own limitations and the strength. Estimating the size of hidden group with one method is similar to walking a tightrope. If possible, apply alternative size estimation methods in one study and try to cross-validate the estimates. There are some triangulation methods that combine different estimates to obtain a single estimate. So for example, if you conduct a study in general population or among students, if you use both direct method, network scale-up method, and crosswise method, then you have 3 different estimates. There are some triangulation methods that allow you to combine these 3 estimates and have one final estimate. And it's not just that, sometimes we need extrapolation methods. So for example, in some of our studies, we conducted the studies, let's say in 10 provinces, but then policymakers asked us, okay, they want also a national estimate. So there was a need to extrapolate some of these estimates from the selected provinces to the unselected and then combine all of them to have a national estimate. I mean, there is a lot that can be done in the field of size estimation. I've done the indirect part. So the indirect methods are finished. If you remember, we said for indirect methods, we don't need registry data, we don't need contact with members of the hidden population. Now I want to speak about the direct methods. For the direct methods, we need some registry data. Okay, so it was not very popular for us in Iran, but I have some examples for you. The first method I want to speak about is truncated Poisson model. It needs one source of data. The method is applicable when individuals are observed multiple times through systems like arrests, clinical visits, or services. This method is used in Australia, in Western Australia, to estimate the number of opioid users. They used the police service provided data that described person processed, which was number of arrests or cautioned for heroin-related offenses, and the method assumes that the data follows a Poisson distribution. This was the data shared in the paper. So in the data set, they had 259 people who were processed by police just once. They had 64 people processed 2 times and 4 people processed 3 times. And then the question was, okay, there are some other opioid users which haven't been arrested or processed by the police. Let's show their number by X. What's that X? If it's simply sum 259 plus 36 plus 4, we underestimate the true size. So we need a formula to estimate the number of zeros which are not observed in our data. There are 2 estimators, very easy. One of them is Chow estimator. You see the formula. Here, n and this 1 means number who are arrested once, n and this 2 number who are arrested 2 times, n and this 3 number who are arrested 3 times. So with this formula, they estimated the number to be about 1,200. So it means something like 75% underestimation. And there is another estimator, Zelterman method. Again, Zelterman method reached to the same figure, about 1,200. So the observed part was 259 plus 36 plus 4, but the total sample was about 1,200. If you do some calculation, it shows something like 75% underreporting. We used this method to estimate the number of self-poisonings in Iran. In West Iran, I think it was in 1 province. Self-poisoning is a common method of suicide, but the rate of deliberate self-poisoning is subject to underreporting due to cultural stigma and also lack of insurance coverage for associated costs. So we used hospital data in a province in Western Iran, and we estimated the rate of underreporting at about 50%. I can't remember the exact numbers, but for example, if the number they had in the hospital was about 1,000, we estimated the final number at about 2,000, which shows about 50% underestimation. So it's a nice method. It just needs one source of data which counts the number of times people are arrested or received service or whatever. The second method is multiplier. The multiplier method compares data from two independent data sources, a benchmark estimate followed by a survey that overlap in a way. We use the method to estimate number of transgenders in Iran. In Iran, people seeking gender reassignment must obtain permission from judiciary-affiliated bodies. To estimate the number of transgenders in one city in Iran, we use this method. We use the records from a judiciary affiliation legal medicine organization, and the number registered with that organization was 350. So they assumed that the number of transgenders in the city is 350. But then we identified 8 transgenders. We had some meetings with them. We built the trust, and we explained the aim of our study to them, and then they finally decided to contribute to the study. And these 8 people indeed formed our seed group, and they tried to recruit other members of their population in their parties, in their meetings. And then in the parties, these seed people ask other people, have you registered with the forensic medicine or no? Have you registered? You registered. So it was a kind of a snowball sampling. And then they told us when they asked other transgenders, finally they estimate that about 52% of them get permission from the forensic medicine or these judiciary centers. So if we divide the crude number of 350 by this proportion of about 52%, we get an estimate of about 680. So it's indirect because we need some source of data, some registry data. We need some level of access to members of the hidden group to calculate our multiplier, but it's easy to apply the method, its mechanism, its philosophy is easy to understand. For the last method, do you remember we had three indirect methods? Truncated Poisson, multiplier, and crosswise. We haven't used crosswise. At least I was not involved in the crosswise study. Sorry, not crosswise. What was the name of the last method? Capture recapture. Sorry, capture recapture. I was not involved in any capture recapture study, and I'm not sure whether my colleagues have done that in Iran or no, because for capture recapture you need at least two sources of data. But I know that here my colleagues in the group use the method to estimate the underreporting of dementia. So it's not only about hidden groups. Sometimes there are some underreporting about some of these medical conditions. But I was not involved in any capture recapture, so I have no example of capture recapture for you. Okay, it was a quick review of studies we have done using different methods, and I hope you find it helpful and useful. If you have any question, I'm happy to answer if I can.
Anyone want to unmute and ask the question? You're welcome to ask, or if you would like to type on the meeting chat facility, that's fine too. Very interesting talk, Raisa. I can start with the first question that what was the main challenges convincing the policymakers? I'm not sure how much they're going to take your advice when you have this many assumptions and formulas and so on.
Yeah, indeed, the reactions were mixed because somehow they knew that the numbers is much higher than what they think. So some of them, I think, appreciated the efforts, and they understand how difficult it was to conduct the studies, how tough the situation was. But some of them, their aim was just to to criticize the methodology and say, no, it's not a wrong methodology, although they were not methodologists. So we had mixed reaction. Generally, it was okay. Most of them were manageable, but some of them were tough. Their aim was to prove your estimates are wrong. And our aim was to prove, okay, we don't want to claim this is the best possible estimate, but it's an estimate. And we believe that previous estimates has underreporting. So we presented lots of examples from the literature, from Western countries, other populations, and finally we managed to convince them. Although these methodologies are not perfect, although each of them has some strengths and limitations, but the estimates are more reliable than the previous estimates based on direct methods.
So it's come to my second question. Anyone else have any question? Anyone want to unmute and talk?
Hello, Reza. Amazing presentation, as always. I have just one question, maybe very simple and naive, but I was wondering, especially for network scale-up method you mentioned there, like it is based on hypothesis, like assumptions. I was wondering, like it is sort of similar to sampling with replacement in a sense. So are there any like error calculations to adjust for that? Or what are your thoughts on that? Because like when we get a sample, they might be thinking of that, like there might be some like the same people in the same in their networks. Hope I'm clear. Yeah.
Yeah, indeed, this is one of the questions the policymakers ask us as well. They told us, okay, if you ask me, if I tell you 3, if you ask another person, they tell you 2, then there may be an overlap, so you overestimate. And then we showed them some evidence in the literature that these overlaps do not create any problem for network scale-up studies. So they do not lead to overestimation or underestimation. Overlap between networks, this level of dependency between networks is not a problem. The main problem are assumptions, and we try to adjust for the assumption as much as we can by applying the correction factors.
Yep. Thank you. Yeah, it makes sense because these are very like small populations too. Yeah. Yep. Thank you.
Pleasure.
There's a question online. There are a couple of questions from Benjamin Phillips. I will read it for you, Reza.
Yeah.
For the single sample count and crosswise, what is the perceived level of threat to the respondent from the actor who might, for instance, know the date of birth, ID card number, etc., and does this risk underestimation?
What's the question again? Sorry.
Okay, I'll repeat again. So for the single sample count and crosswise, what is the perceived level of threat to the respondent from an actor who might, for instance, know the date of birth, ID card?
No. That's about the person himself. So in proxy respondent, you give me 5 statements. I tell you how many of those statements are true for myself. So there is no threat, there is no risk. Or in crosswise, you give me a pair, one sensitive question, one non-sensitive question. Then you ask me, select option A if your answer to these 2 statements are the same. And select option B if your answer to these 2 statements are different. Okay, so I don't reply on behalf of others. There is no risk of like underestimation or lack of knowledge.
Okay. Here's the second question from Alison. Alison just apologized. They were 5 minutes late in case you explained it. Alison was interested in how you explained participants that they would be asked 5 questions. So 4 non-sensitive question and 1 sensitive question. And how you gained their trust in this method and explained it to them.
We didn't tell them we will give you a list with 4 non-sensitive and 1 sensitive. No, we didn't explain that. We just told them, okay, we want to do a study This study is ordered by Iranian Ministry of Health. We respect your privacy. We don't need your like name or address or telephone number or whatever. We just give you a list and we have a sealed box. Just tell us how many of these statements are true for you and then put it in the box. So they didn't know that for the first four one, they didn't know the probability is 50%. So they didn't know our final number is two, our final estimate of the means would be two something, and that something attributes to the sensitive question. We didn't explain the methodology. We just said this is the aim. You are anonymous. We respect your privacy. We don't share with anybody. We don't collect your individual data. Just tell how many of these items are true for you.
So another question from Jake. Jake is wondering whether you thought that something like the friendship paradox, not sure you heard about it, friendship paradox would have any effect in the network scale-up method or proxy respondent. For example, people who have known more people might have different characteristics to those who know less.
Yeah, that's true. Because because it was a talk in which I reviewed many papers, I didn't speak about all details of all these methods. But one of the other correction factors we need for network scale-up studies is popularity factor. So for example, let's assume we want to estimate number of people with HIV. If you ask someone who works in an NGO to provide support to these people, then he knows lots of them. But if you ask me, which is a general member of the population, I may know few of them. So we need some correction factor to correct for that. This is known as the popularity. As far as I remember, we estimated popularity for female sex work and for drug injection in Iran, but not for abortion. And in most studies in other countries, none of these correction factors are applied. Still, without these correction factors, the estimates are higher than the direct questions. But this was a really good question, and then the answer is we need a popularity factor correction factor.
Another question from Andy. Would you put a confidence interval around the multiplier? So as in direct method multiplier.
Yeah, I think there are some formulas to calculate a standard error and confidence interval. Yes, for all of these methods, for all of these estimates, there are formulas to calculate the confidence interval. As far as I remember, for network size, there was no close formula to estimate a standard error. We used like bootstrap resampling methods to calculate the confidence interval. But most of these methods have a close formula for a standard error, and it's easy to calculate the confidence interval. Yeah, I didn't report them here, but it's easy to do that.
Good to know. Anyone else would like to unmute and talk? The question from Nirmali. In the truncated Poisson model, is the estimated X dependent on factors that are country specific? Example, how strong a country's police force that would influence how often someone is arrested. So is the estimated X depend on factors that are country specific?
Yeah, maybe, yeah. That's why I said estimating the size with one method is like walking on a rope. So it's risky. That's why I recommend it's usually advised apply several methods, at least 2 methods or possibly 3 methods, and then try to triangulate the estimates, try to cross-validate the estimates, have a comparison, if necessary, triangulate and combine them to have one final estimate.
So I left in a question similar to this, somewhat similar. How do you cross-validate, and how at least in the direct methods, do you use any real data, or how do you cross-validate?
By cross-validate, I mean if you apply 3 alternative size estimation methods, and if they give you similar estimates, then it shows that your results are robust to the assumptions of the estimators. But if you see big difference between them, then it means that, okay, you don't know which one is true. So let's triangulate and make something in between. But if you go with network scale up, there are some validation steps you can undertake. So for example, let's assume you use 10 reference groups to calculate C, to calculate the network size. You can use this network size to estimate size of some other reference groups. Okay? Because for those reference groups, you have the actual number. If your actual number and your predicted number based on this network size are close, it means that this C is reliable. Then you can say, okay, so now I want to use it for the hidden groups. I know it works well. I tested it to estimate size of some reference groups. It works well. It's robust enough. Now I want to use it for the hidden groups.
Okay. A question from Susanna. Have you ever had to check the assumptions around the 50% assumptions for non-sensitive questions in the single sample count? For example, if a baby boom in a specific year.
No, we haven't checked the 50% assumption, no. But I know what it means. So, okay, let's assume I give the people a list with 5 statements. Now, I expect the mean of responses to be 2 something, because I expect the mean for the first 4 to be 2. So now I have a list with 5, so I expect the mean to be 2 point something, but everything can happen. For example, my final mean may be 1.98, below 2. I cannot claim that the prevalence for the sensitive question is negative. It means that in this sample, this method does not work. Still, there are some solutions. For this mean of 1.98, I can calculate a confidence interval, and then hopefully the upper bound will exceed 2, and then I can use that upper bound and calculate the deviation from 2. So there are some tricks, there are some methodological issues, there are some challenges in use of each of these methods, but we found all of them useful. All of them worked, and all of them, although they have some assumptions, all of them provided estimates higher than the direct methods.
Any other questions?
Hi, sorry, I had just a follow-up question. Thanks for answering the question about the truncated Poisson model. I just wanted to follow up because, yeah, in this example, like supposing if there's a in a country, if there's a change in if the law enforcement something increases, then you might find an increase in the number of 1s, 2s, and 3s, but that's actually meaning that 0 is actually going down. But in this formula, it's actually the more 1s, 2s, and 3s you have, the more 0s you would also have. Where sometimes it could be the opposite if there are changes. If there are like structural changes happening in the system. So is that fair to say?
This is a difficult question. I think there is no right or wrong answer for that. Nobody can answer that. But you are right. If policy changes after a couple of years, then we may see an increase in number of 2s, number of 3s, because the policy is more active, or blah, blah, blah. That's true. That's true, yeah.
Okay, thanks.
Good couple of minutes, 3 minutes. Anyone else have any questions? So Raisa, are there any challenges in publishing your results? So I have seen these methods going in some of your papers, but did you publish in any cutting edge research or any news articles or related to these findings?
We published for almost all of these reference groups. Only for intentional abortion, we could not publish the national estimates. We published a pilot study in one province, but for national estimate, because it was highly sensitive, We just provided a report to the Ministry of Health. Also for MSM, male who have sex with other male, we could not publish the final data. Again, we just reported to the Ministry of Health. But for other reference groups like alcohol or female sex work or suicide, for those groups, we had no problem, no challenge. Yeah, and some of them are published in journals like International Journal of Drug Policy, which is a leading journal in this field. Just for abortion at the national level and for male sex with male, we couldn't publish. It was highly sensitive.
We got 2 minutes. I have a very quick question. The question is, in Australia, do you know how many of these findings or works done using these methods or all those estimates?
The indirect methods are used. I had some examples here. Direct methods, I haven't done a deep search. I just had a quick search. I couldn't find any study in Australia with the indirect methods.